Hi, Caitlin. Thank you very much for your flashcard presentation on tuberculosis. I'm now going to be presenting my case presentation on this disease. So patient AZ is a 46-year-old man who presents to your urgent care clinic. He has a history of homelessness and poverty. He occasionally spends nights in the homeless shelter down the street, but it is incredibly crowded and sometimes there is not enough space for him. He also has a history of HIV and IV drug use as well as alcoholism. You ask if he has any other medical conditions, and he states he's not sure because he hasn't been to a doctor in about 15 years. AZ is incredibly malnourished on exam, so much so that you can see his ribs sticking out. He presents today due to complaints of a cough that has lasted over 2 weeks, including occasionally coughing up blood. He says he's been waking up in the middle of the night covered in sweat. He doesn't really have much of an appetite, and even though he has always been thin, he has lost weight in the last couple of weeks. His neurologic exam is normal, though he appears tired and his eyes are sunken. He has a low-grade fever of 101, his heart rate is 94, his blood pressure is 128/75, his respiratory rate is 22, and his oxygen is at 93%. You notice that he has been having a productive cough with yellow sputum since he walked in, making it hard for him to catch his breath. Upon auscultation of his lungs, he has inspiratory crackles, but there's good air movement throughout. His bowel sounds and heart sounds are normal, and he says he's not in any pain. Based on his signs and symptoms, you suspect this patient has tuberculosis. He is at high risk for this disease because of the following: his homelessness, poverty, HIV status, malnourishment, alcoholism, and crowded living conditions at the shelter. Because AZ is an individual of high risk of having been exposed to TB, a positive Mountall or PPD test would be considered an induration greater than 5 millimeters. If this result is positive for AZ, a chest x-ray and sputum culture are necessary to confirm a diagnosis of tuberculosis. Treatment of TB includes long-term combination therapy, which typically includes a 6 to 12-month course including isoniazid, rifampicin, and rifampin. The purpose of this prolonged course is because you want to be sure the bacteria, Mycobacterium tuberculosis, has been completely eradicated and does not become resistant to the antimicrobial therapy. Since TB is a reportable disease, you would also be sure to report this positive test result to the local public health authority immediately. I hope you enjoyed my case presentation. Below are also my references. Thanks for listening.